Somebody give me a thumbs up if you can see the slides.
Got it.
Fantastic. Thank you.
That's not a thumbs up.
It works. Does the job. Thank you, everybody. Okay, fantastic to be here. Thank you so much for having me along today and to have an opportunity to meet you as a community. It's fantastic to be here. I'm Jo Stanford. I head up the Healthcare Project and Change Association. I'll tell you a little bit about us. So we are a not-for-profit community interest company. So like AphA, we provide communities of practice for project and change professionals and anybody with an interest in project and change management. You know, for me, there's a really interesting crossover with digital and data, projects and change. And so I think there's a lot of cross-fertilization of knowledge and skills that can go on. So we are a UK-wide community. We've got regional networks in Wales, Scotland, Northern Ireland, and across the regions in England. It's free for anybody to subscribe to the HPCA who has an interest. You don't have to pay to participate in some of the events and things that we have. We collaborate with the other associations really closely, looking at, you know, how we can build the sort of non-clinical workforce and what we do to support the development of the professions. And as part of that, I have a real interest in the development of the project and change profession, workforce planning. How do we get the future workforce and pipeline of the profession? I'm a chartered project professional myself and a fellow of the Association for Project Management, but I spent the last sort of 23 years working in the healthcare sector, sort of made it my mission to try and improve project and change capability and maturity in healthcare. And it was useful to see what people were interested in learning more about and knowing. So I did a quick look at sort of what people asked for in terms of a session, and then looked at what support's available. So not all of the things that people are looking for are going to be included in this session. But what I have done is pull together a couple of slides that signpost you to things that will provide those areas of interest to you. So a lot of the areas of interest were around you as the individual, what you can do, how you can apply some of these things in your personal life, how you can apply it to the changes that are going on, but how it might impact you, but also your team members. We have a whole set of events that have been going on called Change Under Pressure, in response to all of the changes that are going on, the abolition of NHS England, the cuts in the ICBs and the CSUs, the impact on trusts in terms of the reduction in spend to meet their funding deficits. So I know that there's a lot of chaos going on at the moment. So we have a series of events that we've been running. I'll tell you a little bit more about that, and some resources and support for those really individual ones. The other area then is around tools and support, you know, templates and things that you can use. There is a community around change management that I'll show you, and there's a fantastic toolkit to support you through the journey of change. So I'll introduce you to that as well. The other specific area query was around neighbourhood health clinical transformation examples. Now, I just happen to know, because I'm doing some work with them, that NHS Horizons have been doing a huge amount of work in this area, working with the neighbourhood health teams. So it might be worth inviting them to come along and do a specific session if that's of general interest to the community, to come and talk about, well, what does that mean and how it's working in practice. But I'm not covering those things on this session, just so that you're aware, so you might be disappointed. What I will cover is insights into change management and leadership of change, what change management is, how you can use an understanding of neuroscience to increase engagement in change, but also creating the environment for change success. So those are the things I'm actually going to cover today. So hopefully those will be of interest to you anyway. In terms of that Change Under Pressure programme, the last of our series of events is actually taking place this Thursday. On the 29th, and it's about neuroscience and a positive mindset. So if you are impacted by change, or people in your team are impacted by change, that's one that's going to focus on the individual. So do sign up to that. It's free. You can scan the code or click on the link on our website and just sign up to that event. And David Bovis, who's delivering that session, he's quite of an expert in neuroscience and change management. So it's going to be an interesting one. And then the other thing was then around the change management community and toolkit. So NHS England has a fantastic change management network and an amazing change toolkit and forum. It's everything you can need in one place. So if you register for that, it's open to everybody to join. I'll send these around afterwards so you can click on the links and register. So hopefully that covers all the areas that people who are interested, and I'm going to dig into the bits I'm going to cover today. Okay, is that good? So let's start with leading change. I've got a quick couple of Menti questions, a Menti question for you now on this particular topic. So if you can scan the QR code with your phone, or just go onto the browser menti.com and enter the code 27247559, and that will get you into the first question. So first question I've got for you, and if you arrived later, if you introduce yourselves in the chat, that'd be great. And if you've got any thoughts or comments, do put those in the chat as we go along. I'm going to take questions at the end, but do put your questions, and Coraline, Lizzie will be monitoring those, and we'll ask them at the end.
Yep.
That's fantastic. Okay, so everybody got that code and link, and what I'll do is I'll just drag the answers across if you can put your thoughts in. So first question: what stops us leading effective change? So lack of appropriate engagement. That's excellent, good one. Time, lack of knowledge and lack of confidence. Fear of uncertainty, fantastic. Clinical and senior management engagement, yep, or the lack of. Other people, yes, people are often the biggest problem. Not sure where we're going and why, yeah. What's the direction of travel? Is it clear? Does everybody know why we're going? Brain space, capacity, yes, being able to engage in it. A lack of knowledge, what are we doing? What's this mean for us perhaps in the change? Fear of unsettling people, yes, that's also a good one, that we don't want to kind of rock the boat and disturb what's working well with something new. Others are not bought into change, yes, that's often the case. Proper impact analysis. Thank you, the analytical team. Well, I would hope, yes, I would expect that from you guys. That's great. Yes, impact analysis. Often we don't have the evidence to say, well, did it work or didn't it? Do we have the evidence to say whether it made a difference? Did we achieve the outcomes? And that lack of knowledge is often difficult to evidence whether or not we succeeded or not. Lack of energy, it's so much hard work. It is absolutely hard work, and resistance to change. Okay, those are some great examples. Thank you. That's a really great set of insights, and a really good range of examples. So we will come back to some other questions later on, so do leave that open for the next question. So thank you for answering that question. And yes, a fantastic set of insights there. But when it comes to leading change, one of the things that I think is often a challenge is, what's the role of the leader in the change? So I'm going to tell you a quick story. So this is K2. K2 is the most dangerous mountain in the world. Statistically, until very recently, a third of people who attempted K2 died in the attempt, consistently, a third. So 1 in 3 people that went up wasn't coming back down. And I want you to put in the chat your thoughts about why people do this. Why do people attempt something like K2 when statistically a third of them aren't going to make it? So why do they do it? What do you think? What motivates them? And what are they aiming to achieve? Stick your thoughts in the chat. So as a leader of an expedition, if you are leading an expedition up K2 and you know that statistically a third of people don't survive, what would you do differently if consistently before every single expedition, no matter how knowledgeable or experienced, came out with exactly the same result? So as a leader, you have a role to play in achieving what? What is the outcome that they are trying to achieve?
Hi, I've just missed a call from you, and
Hi,
I think
Erin.
I'm speaking
I
to the
don't know
right
if you know we can
person.
hear
Is
you.
that correct?
Great. Thanks, Erin. Yes, you can't afford to miss those calls. It might be important. So we've got some ideas so far. The thrill of the challenge, absolutely. We are a strange species that insists on doing things because it looks high or deep or hard, or the urge to understand our own limits. Yes, pushing ourselves. Oh, the absolute optimism bias. If it will never happen to me. Oh yes, I'm knowledgeable. I'm experienced. I know what I'm going to do. It's going to be fine because it's there. Yes, absolutely, Andrew. Adrenaline junkies. Yes, absolutely, adrenaline junkies. There's something about that desire to, challenge yourself, but also there's a thrill, ambition. They've done all the prep, they want to do it, and this blurs their judgment on the surrounding conditions. Oh, yes. So there's a sunk cost to it, isn't there? Because they've put the prep in, they've put the money in, they've put the time in. They've also told everybody that they're going to do this. How much peer pressure or social pressure do you think people feel when it comes to, well, I've started, so I'd better finish? And is that what we have with projects? I've started, so I'd better finish. How many projects have you seen where actually it gets to a point where you go, this isn't really viable, it's not going to deliver the outcomes, we're not really going to create the value that we intended, so why don't we stop? But thinking about it from a leader's point of view, I want you to put in the chat, who is the most experienced person in any expedition group that goes up K2? Who is the most knowledgeable and experienced person in the group? Put your thoughts in the chat.
Oh, what are they called? The people that help you carry things.
Aha, Claire's got it first. Yes, well done.
Yeah.
The Sherpas. The Sherpas are the most experienced and knowledgeable people in any expedition group up these mountains. Are they the most senior in the group? No. Are they paid the most? Certainly not. Do they have the most social status? Do they have the most, reputational support and standing in the group? No. But as an expedition leader, your job is to get the right people with the right skills to achieve the outcome. So what's the outcome? What are they attempting to do? What's the aim? Joanne, thank you. To get to the top. Absolutely. We've all seen those pictures, standing at the top of the mountain and going, woohoo, taking selfies and stuff. And you go, yes. And thank you for the add on there. Because the reason I said about this picture, and it wasn't quite true, this is not a picture of K2. This is a picture of the shadow of the mountain from the summit. So they're on top of the most dangerous mountain in the world, and the shadow of the mountain is stretched all the way across to the horizon. What is about to happen that's going to make their descent very difficult? Sunset. It's about to get dark. So when we talked earlier about the sort of optimism bias, it's not going to happen to me, we're focused on getting to the top. What they're often not focused on is getting to the top and down again safely. And thank you to Joanne and the other person that put that and down again bit in, because actually what we often focus on is the launch, the ta-da moment, ta-da, we've done it. It's a new IT system, new, data collection, ta-da, we've done it. We've launched it. Woo, right, off we go. But actually, that's only the start, because the hard bit is coming down again. And when do you get the value? So if I said a third of the people died attempting K2, but 90% of those people die on the way down. Yes. So one of the things we have here from a leadership perspective is, do we have the right mindset? Are we focused on the right things? Are we focused on the outcomes, not the targets? Are we focused on getting everybody that set off down again safely? Have we stopped to think, oh, should we continue on? Is it still safe to continue on? Now, you can read about this case study because Cranfield University used this case study from this particular expedition to write a book about project resilience, but also to look at what are the things that go wrong in projects that are similar to things like this expedition that are about leadership behaviors. So one of the things when we look at leadership behaviors, well, how does that impact what we do and how does it work in our sector? I've got a couple of examples for you, and this is about not achieving the product, because often we do that. We churn stuff out all the time. You know, there's a new IT system, there's a new service, there's a new, guide, there's a new policy. What we're not very good at is implementing and embedding them till they become the new normal and everybody's using them, and then we get the value. The people who go on K2 don't get the value until they come down again safely, because the outputs, the outcomes of it are, well, I can now go on a speaking tour, or I've got the confidence to do new things in my life that I wasn't able to do before. But also, how many of those that survive have PTSD or physical illnesses or injuries that they sustained along the way? Did they plan for that as well, potentially? So being clear about the outcomes, both the positive and negative ones, and making sure we achieve them is really important. A couple of examples. I didn't pick NHS ones because I think we could all probably think of one, couldn't we? But these are a couple of really clear examples of hitting the target and missing the point. Fire control project. So government decided that it would be much more sensible if, instead of having hundreds of different fire stations dotted all over the place, little communities, lots of small groups, that it would be much more efficient if we had 7 major hubs, all connected up, all of the information's going, we can manage them all effectively, we'll have the latest technology, we'll have the latest systems to enable them to respond quickly and get people out there. And so they built them. They built them at great cost. But what they didn't do was they didn't take people on the journey with them. By the time they had built these hubs ready to launch, only one group had actually agreed to use them, because they hadn't contracted, they hadn't engaged people, they hadn't got them organized to get involved with it. So they launched them, ta-da, top of the mountain, woohoo, we've succeeded. But did they get any value? No. Because 6 of them remained empty for about 18 months, whilst they had to go back cap in hand and say, please, can you use them? Please, could you come along? Please, can you change what you do and how you work and your teams and your networks and your community? Because we want you to work differently, and they hadn't done any of that stuff. And it cost them £1 million a month for these to remain empty. So you can imagine what value they thought they were going to achieve by putting these things in place was eroded very quickly because of the additional cost. Another example is the Foreign and Commonwealth Office. So I think James Bond and lots of smart people in suits doing very diplomatic things. These are placed all over the world. They're in every country. There's offices and teams of people all doing very diplomatic things. In those same countries, and often in the same environments and cities, there is also the Department for International Development. So DFID is grassroots, on the ground, supporting poor, uneducated, deprived communities, supporting them with the best to try and improve their lot in life. And they decided, because they were all kind of in the same cities, well, wouldn't it be more cost effective if we just smushed them together and put them into the same office group, and we'll cut our costs and we'll make it much more efficient? 2 different cultured people you could not meet. They didn't bother with any of the, well, let's see what happens when we bring people with really different perspectives on the world together, different values, different approaches, different ways of working, different cultural backgrounds. And it was a disaster. The tension, the fighting, the people went off sick with depression and stress, and And anything that they had hoped to achieve by getting these people smushed together, again, the tanking of productivity meant that they lost any of that value that was meant to be achieved because they didn't consider the people on that journey. So what does a leader need to do to think about the behaviors that make that leadership journey more effective? Setting a clear vision and goals. So that was one of the things that you put in your example. Good call. Lead by example. And this is about culture and behaviors. This isn't necessarily about copy what I do. Empower and trust your team. If you think about the K2 example, do the Sherpas feel confident to speak up when they think things are going wrong? If your team aren't feeling confident to be able to do that, or you're not feeling confident, then things will continue on and maybe get worse. Foster a culture of continuous improvement. Part of the challenge is often, well, we know our job, we know what we're doing. You go, but the world's moving on. And are we keeping up? If we create an environment of learning, can we keep up as we go and create a culture that supports that? Communicate effectively and often. And that's in a way that people want to receive it. Recognize and reward performance. When people are doing a good job, they've achieved a milestone along the journey, they've put in the effort, are we rewarding them and recognizing them? Develop your team. One of the comments that was about, having trained for the expedition. Do people have the skills and abilities? Do you need to train them to be able to do the new thing that you're wanting them to do? What investment in time and effort do you need to make to give the people the skills they need? You like this one. Data-driven decisions. Now, that data might not just be, numbers. It might be stories, and it might be insights that we can gather from experience and turn into meaningful insights and data. Encourage collaboration and teamwork. This isn't a lone mission. This is, we need to get everybody there and back again safely. Who do we need to have as part of that team to bring their knowledge and skills and insights? Stay adaptable and resilient. The leader's role is to facilitate getting to the destination and achieving the outcomes. They're not a lone warrior. They're not somebody who needs to know all the answers. Their job is to make sure they've got the right people and to ensure they're getting them all to the end safely. So, change management. Anybody have any qualifications or experience in change management side of things? Yeah, if you do, stick them in the chat. I'll move on to the next Menti. So, next question. What is the top barrier to successful business transformation? Giving you 5 to choose from. I want you to pick one of those 5. What do you think is the top of the list? I'll just give you a moment to have a go at that. Let me drag that back in. I'm just going to give you a little bit of a minute to answer that before I show the results, just so that everybody can make their own decision. Okay, so the ones we've got so far: resistance to change, coming out a little bit on top; inadequate sponsorship; scope expansion and uncertainty. That is not an unfamiliar thing we experience, isn't it? Let's go for anybody who wants to contribute their ideas, their thoughts. I'm going to show you the correct answer. So, resistance to change. So whoever came in at the last minute, yep, you were on the right track. So resistance to change, and it's not that the others weren't, it's just that that's the one that comes out top, and by a margin. So this research was actually done in 2010, but some analysis of it recently says, frankly, not much has changed. And if 82% of projects are impacted by resistance to change, then this has got to be one of the most important things to focus on. How do we reduce resistance to change? So those that relate to change management specifically, these are the ones that have got stars next to them. So all of those that chose inadequate sponsorship, you're nearly right. Very close, not that far off, but also very important. But if you look, the top three: unrealistic expectations, inadequate sponsorship, resistance to change. These are all change management. These are people-related things. These aren't about, can we deliver it? Is it on time? Did it do what we expected it to do? Is it functional? It's about people. And these are the things that we really need to focus on in more detail. So just a quick definition for those that it might be new to. Change management represents a domain of disciplines and practices that enable stakeholders of change to adopt the mindsets, behaviors, and capabilities required for that change to deliver full business value. And it's those things that enable the value to be delivered. It's not the product. Where does it sit? Because I think it's important to understand, where does change management sit? And this is Julie Atkins' Change Onion, which you'll remember because it's quite funny. Implementation, that's the product. That's your new, it's your EPR system. It's your e-rostering system. It's the new policy or your new service. It's the product. It's the thing. And that's at the heart of it. You've got to have something that changes things. You've then got your business change wrapped around that. So what are we doing differently? How does it affect our processes, our operational systems, our ways of working? What is it we need to actually do differently? What's the mechanism that makes it work in practice? The people management bit is about taking people on the journey with you, but also equipping them with the skills to be able to use that new product in the way the business needs them to, and do it in a way that then delivers the value. So that's about the adoption as well. How many people are adopting it? Are they adopting it sufficiently for the business to achieve that value? And the resistance to change bit. We often think about resistance to change as it's something that they are failing to do. But actually what we're failing to do is often to make a compelling case for it, which says, why is this important? And what can we do to help you engage positively to take you on that journey? Now, this is the Kubler-Ross change curve. You may have seen this. It's linked to grief. And change and the impact of change often feels like grief, even if you know it to be a positive change. Because when you're moving on to do something new, you're also having to let go. You're having to let go of what was comfortable and familiar, and it was something that you maybe enjoyed doing, or the way you did it, or it linked to your sense of status or your role. And actually that new thing, whilst it might add value and might be good in the long run, is actually a difficult journey to go on. You've got to become uncomfortable with it. Now, I particularly like this image because it's quite funny, but also it's the only one I've seen that actually builds a bridge. And our job as change agents and change, champions is to build the bridge and not let people fall into the pit of despair. What are we doing to help people and hold people's hands across that chasm and into the new way of working and doing things? And that's what the toolkit is really there to help with. But it's a mindset thing. It's a human behavior. The tools are very good for planning. They're not very good for doing. The doing bit is engaging with people and connecting with them and understanding them. So this is where we get into what goes on in people's heads when they're presented with change. So 25 reasons why it won't work. And put in the chat, how many of those 25 do you recognize? I mean, not name them, but 10, 20, 4. And which one's the funny one that you can spot it was written by Americans? So this particular piece, it comes from ProSci, which is a change management consultancy that does fantastic research into change management. And I'm going to give you some insights into how to tackle some of these things that when we look at them as kind of why it won't work, these are actually red flags. These are things that people say when they're feeling either threatened or pressured by change, or they haven't got the capacity to change. And it's not that they are saying, well, I don't want to do this. It's that there are things that are in the way that are stopping them from engaging positively in it. So recognize some of those, heard some, have thought them yourself when presented with the change. Yeah, because we've all been subject to change as well. So these are the things to listen out for if you're putting a change in place, because these are the things that are going to let you know that somebody's struggling to engage with your change and they need a bit of attention and some effort to put in to support them. And this is where the neuroscience bit comes in. Do we have any neuroscientists in the group? Stick your hand up if you are a neuroscientist. Always good to have professional opinion on this. If not, this is a very simplistic view because I'm not a neuroscientist. I did the neuroscience course for coaching, which is how we apply it in this context. But there's three main bits. Neuroplasticity. Have you all heard the phrase, you can't teach an old dog new tricks? Is everybody familiar with that one? Yep, some of you familiar with that one? Well, the research is in, you can. Turns out you can teach an old dog new tricks. They just have to be motivated. And it's the same with people. What's the motivation that's going to get them to learn something new? And unless you have a degenerative brain disease, you have the capacity at any age to learn something new. But you've got to be motivated. And neuroplasticity is building new neural pathways in the brain. It's connecting up ideas and thoughts and information about how to do something and going, aha, right, now I know. And you can see it happen. It's fascinating to see it. Brain chemistry. This is how we feel about change. It's the chemical feelings that come out. So if people like, how many people don't like horror movies? I'm sticking my hand up for this one. Stick your hand up if you don't like horror movies. There's two of us. Thank you, Judith. Yes, Joanne. Anybody else? Stick in the chat why you don't like horror movies. What is it about it that is unpleasant? Why talk a little bit about it. So the thing about horror movies or things that are kind of scary or frightening, they generate brain chemistry, and it's an automatic response to something that is a threat. Unpredictability, feel anxious, uncertain. Yes, good stuff. Out of the comfort zone. Yes. Fearful. It's, all of those feelings and sensations. The third element, and we're going to come back to that brain chemistry bit, brain waves. This is about how the state that your brain is in order to have thoughts and self-awareness and to be able to engage and connect with something. We're going to do a tiny bit on each of these, but we don't have a lot of time in this session to cover much of it. So brain chemistry, we're going to start there. So I want you to do a quick brain experiment with you, if you may. And what I'd like you to do is, trust me on this, it won't hurt, and nobody can see you. So I'd like you to close your eyes, take a deep breath in, slowly let your breath out, and with your eyes closed, I want you to take yourself to your happy place. Where do you feel most happy? And I want you to visualize that and think about what that looks like, who's with you, what's the sensations of being there? Is it warm? Is it cold? How does it feel? Just let it wash over you. And if you're not someone that can visualize things, think about something that makes you feel good. It might be a smell, a scent of something that evokes really positive feelings. Just let yourself be in that place. And then last breath in. Slowly let your breath out. And open your eyes. Everybody do that? If you did, put in the chat, how does that make you feel? How do you feel now? What's the sensation that you feel? Calmer. Yes, relaxed. What else? Anybody else? So I'm going to explain why that is. So the brain, can't tell the difference between fantasy and reality. So which is why you can sit in front of a horror movie in the comfort of your own home with a nice cup of tea and some biscuits and feel scared. And it also can't tell the difference between something that is a physical threat and something that is a psychological threat. And what happens is that the amygdala, you can see this is a very technical drawing here, the amygdala, the base of the brain, is the bit that is triggered when we sense threat. And that can be real, it can be imaginary, it can be physical, it can be psychological. But it triggers in exactly the same way. And when the amygdala triggers, it's because it feels there is a sense of threat. And its reaction is to respond. You're not thinking about it. It blocks your prefrontal cortex, stops you thinking. It's fight or flight, fight, flight, or freeze. And that's where we get that adrenaline rush. Your heart's pounding, you're sweating, your muscles are tight, you want to move, or you're wanting to withdraw, you're wanting to hide, or you freeze and you don't know what to do and you can't decide which way to go. And those things happen when we are presented with change that makes us feel threatened. And often the things that happen to us in our work life are things that threaten what we do, how we feel about ourselves, how we feel about our job, what do we do day to day, our sense of self. And so when we tell people that change is coming, oh, by the way, we're getting a new system, it's going to replace that thing you've been doing for 10 years. We're reorganizing the team structure. So you'll have to apply for your own job. You might be working with new people over there, but it's going to be good for the organization because it's, efficiency and productivity. And you don't get a warm and fuzzy glow off of efficiency and productivity, let's be honest. But when we're presenting people with change, once we trigger somebody's amygdala and they've developed that fight or flight sense, it's really hard to switch off. Because every time you talk about that change, it's going to trigger it again. So how we approach people with change is about creating positive brain chemistry to enable the amygdala to be switched off, which allows the prefrontal cortex, the thinking and creative and engaging bit of the brain, to be actively involved. How we frame change is critical to this. So what are the things that we need to do? One of the things that you brought up in your example earlier was, actually, I don't have the energy to get involved. So traditionally, okay, it's on top of the day job, you've got to keep productivity going, you've got to keep doing a day job, but also learn this new thing, work differently, integrate it, apply for your own job, but just keep productivity going. We don't have the brain space for that because we're already investing all of our energy in keeping things going. So if you want people to engage in your change, you have to give them space for that change, mental space. 20% of the body's energy is used by the brain. When you ask them to think or do something new or different, it requires more energy than doing what's familiar. So you have to create the space for change. Energy consumption. Pattern recognition and familiarity. If you're wanting them to do something different, it's much easier for them to understand and relate to it if you can make it something that they are familiar with. So my example of where this doesn't work is, I remember seeing adverts years ago, and I remember looking at them going, I have no idea what you're talking about. Absolutely no idea, no frame of reference. And they'd keep saying this phrase, and I go, yep, no, I don't know what that is. And what they kept saying was, there's an app for that. So remember back to the sort of mid-2000s? There's an app for that. I was like, what? What's an app? What's that? Who had a Nokia 3310 before a smartphone? Stick your hand up if you who didn't have a Nokia 33. We all had Nokia 3310s. Yes, exactly. All had Nokia 30. And it was great because you text by repeatedly pressing the button to get the right letter. It made phone calls, it sent texts, and you used the snake game, and it was brilliant. And then this new thing came along that was so radically different, it has entirely changed the world. And I was so uncomfortable by it because I didn't understand this. I actually went out and bought an iPhone just to find out what it was I didn't understand, because it made me uncomfortable to feel like I was left out. But how many people are still left out? That they don't understand how they work and they don't know how to engage. And yet the world now is revolving around them. Pattern familiarity, we need to make it relatable. How can we make it something that people understand so it's less of a threat? And then hunting and laughing. And this is about creating positive brain chemistry, which is about saying, am I creating a sense of challenge? Oh, if we create a bit of a, does anybody do Sudoku or Wordle or, crosswords and puzzles? You don't really get a prize for that. What you get is a sense of satisfaction. And that's going, yes, I've achieved it. I've finished it. I've got a sense of, achievement and a job well done. That's dopamine, and a lot of us need a hit of dopamine to feel like we're continuing to do a good job. And that's the hunting bit, that's the challenge. But then the laughing bit is the oxytocin and the serotonin. That's the sense of feeling belonging, a part of something. That's your happy chemicals that make you feel good. All of those things are really important to get people involved in change. So reducing resistance to change, we've got a series of things that we can do in relation to that. Listen and understand people's objections, because they might have a legitimate reason to object. They might know something you don't know. They might be the Sherpa who's about to tell you there's a crevice you're all going to fall down. Focus on what and let go of the how. Outcomes, not processes. Nobody goes on holiday because they enjoy the journey, unless it's a cruise. Nobody goes on it to stand in the airport, to go through security, to eat the expensive food in the airport, to have the cramped in a plane with terrible food and terrible air. And, you go for the destination. You go for the payoff at the end of it. Focus on the destination. Remove barriers, and this is time, resource, money, and workload. Create the space for people to be involved in the change. Provide simple, clear choices and consequences. Options empower people. Give them a chance to get involved. Give them an idea of how they can participate so that they feel like they're belonging to this change and contributing to it. Create hope. Is there a better vision of the future? Now, it might not be better for them personally, but we all work in the public sector because we all want to make a difference ultimately. Is it better for the patient? Is it better for reducing, the waiting time, so people are going to get seen quicker, so fewer people who, die of cancer before they get diagnosed? What's the benefit of it? Show the benefits in a tangible way, and this is where your fantastic data analytics skills come in. Case studies, the data, the information, the examples, the pilots. This is what happened. This is how it went. This is the value that we got from it. That stuff's incredibly convincing. Make a personal appeal. You aren't necessarily the right person for that message to come from. So who is? Now, often we respond to people that we know and we respect. So that's peers, and that's people within our communities. And that might be professional, it might be team lead, it might be somebody within our space. Who's the right person to get that message across? And then convert the strongest dissenters. So the people who are going to be the most vocal in disrupting your journey, understand what motivates them, because they can quite easily spread that discontent through, messages. Understand what's motivating them. And is there something that you can do to get them on board? De-fear it for them, so that they can de-fear it for other people, and they will be your strongest champions if they get it and they see why it adds value. Demonstrate consequences. What will happen if no action is taken for them and for their patients or their service users? Why must we do this? What's the driving force? And provide incentives, but with caution. When we looked at it, we're not talking about bribing people to do it or coercing people to do it. We're looking at how we can engage people in a way like creating a challenge, get them involved in helping to design it, get them to involved in solve some of problems, because they get a sense of satisfaction, and that can be a payoff. So have a think about those, and think about the work that you do at the moment. What are the things that you might go away and try if you're working with stakeholder groups around change or around implementing something that links to your work? What one of those would you think about going away and using in practice? So have a think about that, and maybe put your answer in the chat. So, environment for change. I'm mindful we're running out of time, so I'm going to have to go through this really quickly. What does a positive environment for change include? Now, I'm going to give you a chance to fill in that Menti, but I'm going to keep talking while we do it. So let me just move it on so it's on the right question, and then I will come back to the answer. 1 second. Okay, so get your thoughts in there, and I'll just talk a little bit about what it looks like from an expert in this area. Amy Edmondson, Harvard professor and fantastic researcher into organizational psychological safety and change. And there's a couple of things to think about when you are leading or engaged in change. One is the organization, the environment that that change is happening in, the people who are involved in it. So what needs to happen to make those people feel safe, feel engaged, feel included? And part of that is about the environment that you create and your team creates. Organizations are not one homogenous thing. They are a group of teams that make up an organization. And if we all have influence over our teams and we can create positive environments for change, then we collectively make the organization culture that we want to see. So as part of that, there's a fantastic book of hers called Teaming and Teaming to Innovate. How do you get people to work together collaboratively? How do you build your expedition team? And there are 4 foundation points to it. Everybody has the freedom to speak up. And this is where your Sherpas could have come in to save people on the way, going, right, okay, we need to stop and pause this now, because actually we've spent too much time on, we're not going to get down safely. We need to rethink this. Experimentation. This isn't a binary success or failure thing. Everything that we do gives us knowledge and information. It gives us data. That data can inform decision making. We are making assumptions when we're doing something new. And those assumptions may be wrong, but they're based on the knowledge we had at the time. If you think of what you try as an experiment, whether it works or whether it doesn't work, the information you get from it is valuable because it helps you shape where you go next. So it's not that we failed, it's that we experimented and we got valuable information. Collaboration. Have we got the right people involved in this? Do they have the skills and abilities to do it? And ultimately, do we stop and reflect? Is it going in the right direction? Is it creating the outcomes we wanted? Do we need to change tack? Do we need to stop doing this? Is this no longer viable? Being able to build in that reflection is really important. I won't cover the rest of that now, but those are the foundation stones that then build the culture that enables that positive engagement. So those are the things, that's the place to start. And then it's the things that people are affected by. And if you have a look through these, there may be one more than others that you resonate with. So this is David Rock's SCARF model, and it's people are motivated by different things. They might be motivated by status. It might be, I feel valued, I feel respected, I feel like my knowledge and expertise is considered important. If you take that away, you are going to lose those people. So how do you build that in to let people know that they are valued, that their status is important? Certainty. I know where I stand and I know what's going to happen. It may be the change outcomes aren't clear, but if you give people an understanding of the process, this is how we're going to get to that destination. It gives them a route map to follow. They won't feel lost and uncertain and sense of anxiety around it. Autonomy. They want to feel like they have a say, that they're participating, that they're heard, that they can contribute to it. We need to build that in so that people who are motivated by a sense of autonomy feel like they are a part of the solution. Relatedness. And this is about a sense of belonging. A lot of us are cling very much to our sense of belonging as part of a team. We spend, most of our lives with our work colleagues, more than we do often with our families. And our sense of belonging to that team, the identity, the work that we do, the culture that we've created is incredibly important to people. If you're going to change that, how do you create a new sense of belonging so that people don't feel alienated by it? And finally, a sense of fairness. Do people feel like they are being treated fairly, and are they seeing others being treated fairly? And how do they then respond to that? Because the fairness thing is really, really important. How are you approaching it to make sure that you're treating everybody fairly? If you're communicating with stakeholders, you need to ensure that you are capturing each of these elements in your communication, because you don't know what that individual is going to be motivated by, but you don't want them alienated by it. So engage them through all of these elements to make sure that everybody feels included. Okay, let's have a quick look at the results and see what you said. So, yes, no blame, free to fail. That's absolutely it. Feeling psychologically safe. Everybody's on board on the journey. Safe to speak up. Good at what we do, and we can do even better. Yes, that's nice. Again, learning environment. Customer engagement, we're doing it for them, not to them. I would suggest with them, not necessarily for them. We want them with us on the journey because they actually might be the Sherpas. And no stupid questions, absolutely, because we need to challenge what's happening to know whether it's still the right thing and on track. Being able to contribute to change and those contributions are recognised, absolutely. That sense of both belonging and a sense of status that, you know, have contributed something of value. Okay, so fantastic. I'm just going to quickly move on. There's one more element which I don't have time to cover, unfortunately. The people that you engage in that change are going to be the ones that are going to help you to deliver it. It's not a one-person show. So when you think about the organization and the hierarchy of the organization, change is about people from different groups, different teams. And what you need to be able to do is recruit the right people to be a part of it. Recruiting your allies, your ambassadors, and your advocates. So who's going to contribute their knowledge and experience from that part of the organization so that they're the Sherpa for that particular team that can go back and say, right, this is what we're doing, but also bring back that intelligence that says, actually, this is going to be a problem here because of the way we work and the way we do things. These are the people who are going to design the change for you. I'm just going to skip over the next slide because we don't have time to cover it, I'm afraid. I'm just going to, but you can have a look at it afterwards. And it's about building your change network and how you get people involved. But then ultimately, you need to do it. You need to get those people together. You need to help them to make that change happen. So after today, what are you going to do? What do you need to be change ready? So you need a clear destination. You need to learn from the past so you don't repeat mistakes. Positive mindset to enable people to engage creatively and cognitively. A cohesive, skilled, equipped and empowered team that have the skills to be able to do what you need them to do. A support network of like-minded allies, advocates and ambassadors. A clear vision and the right people on the journey. Celebrate along the way to keep everyone positive and on track. And a plan to reach your destination safely, successfully, and bringing everybody with you. So I know there's only a couple of minutes left, but stick your hands up if you've got a question, or if I don't see any questions, I think pop in the chat.
No, I haven't seen anything yet.
But if you're interested and you want to learn more, we have some resources. So if you scan that, there's a bit of our website that talks about change management, the roles. There's a free e-learning module that you can do. There's a toolkit and there's links to that. There's an interesting webinar for those that are leading change on the culture of change. And you can subscribe to be part of it. That online learning module, Introduction to Change Management, is part of a suite of free online learning modules that are on the NHS Learning Hub. So feel free to have a look around to do those. And then this is an area you have more interest in or you think would be useful. Here's some of the training that we do at HPCA. And we do them with any organisation, both groups and individuals. So have a look and see if there's any more. And just have a think about what you're going to do to support yourself and your team through change. What are you going to do next? So I'll leave that with you. You don't have to fill that in, but I'd like you to have a think about it and write it down for yourself so that you know you're going to take something away. Okay. Sorry, Caroline. I've run over a little bit there.
That was good timing. No worries. Yeah, we have 1 minute if anyone has a question that they just absolutely must ask.
Or comments
otherwise,
or anything.
yeah, you can leave it in the chat or we can always send questions your way afterwards if needed. But yeah, if anyone has a comment or something they want to share or anything to say before we wrap up. David says, thank you.
Very welcome. I'll be sharing the slides. And there's also some links. And also, if you're interested in any things we've covered and want to have a look at a bit more research, anybody that likes to read up on stuff, then there's some further reading.
Awesome. Perfect.
So I'll send you a copy of those slides.
Great. Thank you. All right. Well, thank you.